Thank you, Bert, and for the invitation to speak and for all of you coming this afternoon to hear what I have to say about this. I had hoped that we would be back in person to launch the seminar series this fall, but COVID has surprised us once again. I had also hoped to talk about something other than the COVID pandemic. That's what I spoke about last year. But the epidemic, with its continuing surprises, continues to keep giving us interesting things to talk about. And so I'll be talking about herd immunity and the possibility of thinking of it in terms of mischievous immunity. So when I spoke last fall, I began to talk about the various metaphors that had cropped up during now the early months of this epidemic, and I'm planning to extend that commentary now. Last year, I focused on the language of waves. Epidemiologists have been writing about epidemic waves since the mid-19th century. And when COVID began in winter and spring of 2020, there was, of course, much discussion of whether there would be one wave or multiple waves. In April of that year, Mark Lipsitch and colleagues described a series of different wave forms that might be possible. None of those are quite exactly what happened, but it's been interesting to see how this has now played out over the past 18 months. I would love to hear Mark's thoughts on this, but he regrets that he had a scheduling conflict. But one of Mark's colleagues, Michael Osterholm, recently said how humbled he feels by COVID, telling the New York Times, "We are still really in the cave ages in terms of understanding how viruses emerge, how they spread, how they start and stop, and why they do what they do." And it's a bit demoralizing to have a senior virologist and epidemiologist 18 months into an epidemic pleading humility, given how much effort has been made to try to understand this current epidemic. One complicating factor has been the geographic complexity of COVID. You can't really talk about what one trajectory COVID will follow because it follows different trajectories at different places at different timeframes. Massachusetts, Florida, and Texas have had distinct trajectories, although you can see there's more overlap in them than I would have guessed before putting those three graphs side by side. And when you integrate all of the data from the 50 US states into national data, you start to see a pretty clear pattern of waves. And a similar thing happens on the planetary scale. And I was beginning to wonder as I was looking at this, and someone listening might have this idea, does each of these three peaks represent a distinct strain of this virus? And in that sense, is it even right to talk about 3 or 4 waves of SARS-CoV-2? Or should we really consider ourselves to be in the midst of distinct epidemics of distinct viral strains? Now, I don't have an answer to that. I will leave that answer to the epidemiologists and the virologists. Another thing I spoke about last year was the use of forest fire as a metaphor, which has mostly existed on the periphery of the public discussions of COVID. Although both Michael Osterholm and Mark will say that it actually might be a much better metaphor for what happens. The language of forest fires of COVID hasn't become widespread, even though it remains an apt description. As we've seen, COVID has smoldered and then burst back to life whenever conditions have been right. And so while waves and fires remain interesting, I want to focus my remarks on herd immunity. I had touched on this in passing last year, based on work I had done with MIT anthropologist Stefan Helmreich. We had thought that at the time that the idea was fading from view. There'd been a lot of discussion of herd immunity early in the pandemic, but then it seemed to dissipate. But as I'm sure many of you have seen, it has been revitalized repeatedly over the past year, forcing me to re-engage several different times. I just published an updated editorial last week in the American Journal of Public Health, based on work that other historians have done, looking at the history much more carefully. And as we have done so, subtleties of the concept have become more evident. And we've seen experts continue to invoke herd immunity to defend policies of widespread infection. That continues to be a popular policy proposal in some quarters. But as you'll see from my title slide about mischievous immunity, I'm specifically inspired by comments made by George Davey Smith when he gave his epidemiology seminar here last March, and I will come back to him a little bit later on. And so if you're interested in tracing the history of an idea, like the history of herd immunity, it can be surprisingly tricky to do. The most direct approach is to trace the history of occurrences of a specific word or phrase. Now, in the old days, this was backbreakingly difficult to do. To have found the first occurrence of herd immunity, you would have had to have read the entire literature written by proto-epidemiologists in the 19th century and hope that your skimming didn't lead you to miss the rare occurrence of this phrase. The advent of digitized sources over the past 2 decades has made this much easier. Anyone can now go to Google Books or HathiTrust or other places and search for early occurrences. If you do this, you just have to be careful. Not all sources have been digitized, and all of the search engines are glitchy and return only partially reliable results. So you have to look very carefully at the results to make sure that they are robust. One quirk of COVID is it briefly made this kind of work easier to do. The HathiTrust and other digital repositories invoked the public health emergency to make available a far larger share of their digitized corpus, so you could search much more broadly during COVID than you used to be able to. At Harvard, unfortunately, our emergency access ended last week, so now we're back into slightly more limited digital repositories. And when you trace the history of a phrase, you can quickly run into a problem. The meanings of a phrase change over time. Virus, for instance, meant something very different in 1599 or 1728. Herd immunity's meanings, as you'll see, have also changed as well. So instead of tracing the occurrence of a word, it often makes more sense to trace the history of a concept, tracing the history of the idea of what we mean by herd immunity. But this requires constant and subjective judgment calls about whether a past author's concept is actually the one that you're interested in. And so I might have one meaning of herd immunity, and then it requires a judgment call to see if a 19th century writer is really writing about the same thing. So both of these challenges of word searches and concept tracing complicate efforts to get a robust and reliable history of herd immunity. When I did a quick search at the start of the epidemic in 2020, the earliest example I found was in 1916. But a graduate student in Princeton, intrigued by the essay I published in Lancet, did a much more thorough search, and he found an 1893 report written by David Salmon of Salmonella fame, who was the first director of the US Department of Agriculture's Bureau of Animal Industry. So he was one of the first federal veterinarians. He was interested in ways of improving American livestock, which makes sense given his job. And in addition to emphasizing the importance of careful selective breeding, he encouraged intelligent care and scientific feeding of livestock. He was especially concerned about the over-reliance on corn to feed pigs. So he cited studies of swine flu in which pigs fed a more nutritious diet were more likely to survive. He concluded that, quote, "These facts show that something besides individual immunity. They demonstrate the possibility of obtaining herd immunity." And so this was, as far as we can tell, the first occurrence that has been found in 1893. His explanation of what he meant, however, muddies the waters. He wrote that he believed that with hygienic surroundings, proper exercise, proper food, and by practicing the principles of breeding already enumerated, much can be accomplished in developing animals with more than an ordinary power of resisting sporadic and epizootic disease. So when he says herd immunity, what he's really talking about is individual immunity and nothing about properties of a herd. If you look more widely in the report, his other writing shows that he and his colleagues, again, this is in the 1890s and the first decades of germ theory, were really struggling to understand the new discoveries of bacteriology and the complex relationships of individuals, environments, and susceptibility. So it's not clear that his discussion really has anything to do with what we mean by herd immunity. And then after this one occurrence in 1893, the trail goes cold for 2 decades, and it doesn't resurface again until 1916, again at the US Department of Agriculture. Now, it's plausible to assume that the idea had continued to circulate, or some idea or the use of this language had circulated amongst USDA researchers between 1893 and 1916, but no specific evidence of that has been found. When herd immunity does reappear in 1916, it does so not in discussions of swine flu, but of contagious abortion, epidemics of spontaneous miscarriage that struck cattle and sheep. This disease had been described in the 18th century, and in the 1890s was traced to a bacterial cause, brucellosis. By the 1910s, contagious abortion had become the leading contagious threat to cattle in the United States. Farmers traditionally destroyed or sold off their affected cows. Kansas veterinarian George Potter realized that this was exactly the wrong thing to do. He had observed that most cows recovered from their first exposure to contagious abortion and developed immunity. Calves born from affected mothers inherited some of that resistance. As a result, Potter argued, those recovered cows were actually the most valuable members of a herd. farmers needed to manage their herds deliberately to collect resistant cattle and use caution whenever new cattle were introduced. Potter and his colleague Adolf Eichhorn described this phenomenon as herd immunity in the Journal of the American Veterinary Medical Association in 1916. As they explained, quote, there is a constant tendency for the disease to die out in an infected herd, provided susceptible material is not introduced into the infected environment. They described the specific case of a cattle herd maintained at St. Elizabeth's Hospital in Washington, D.C., the government hospital for the insane, where an outbreak ended when they stopped buying new cows. As they concluded, a definite herd immunity seems to have been established. So this is much more familiar to our modern concept. Potter further elaborated his thinking in a series of circulars and farmers' bulletins. As he advised in 1918, abortion disease may be likened to a fire, which, if new fuel is not constantly added, soon dies down. Herd immunity is developed, therefore, by retaining the immune cows, raising the calves, and avoiding introduction of foreign cattle. He also hoped that a vaccine would soon allow farmers and ranchers to provide immunity to their herds. The phrase also appeared in the work of another USDA veterinarian, R.R. Birch. During World War I, food shortages forced farmers to consider feeding urban garbage to their pigs because other sources of food were too expensive. Birch warned that this could trigger outbreaks of hog cholera. However, with careful use of serum and vaccine, Birch thought it was possible to achieve herd immunity. Potter's concept reached England in 1917 and 1920 in summaries of his work that were published in the Veterinary Review and Scottish Agriculture. Now, this idea arrived in England at a crucial moment. Armies and navies had struggled mightily against infections during World War I, and influenza famously had devastated populations worldwide in 1918. Motivated by these shocks, medical researchers worked not just to identify and treat pathogens, but also to understand their population ecology. How did pathogen virulence and population resistance drive the rise and fall of waves? Writing in The Lancet in July 1919, bacteriologist W.W.C. Copley described experimental epidemics he created in groups of mice. As he wrote, unless there was a steady influx of susceptible mice, the rising prevalence of immune individuals in a population would end an epidemic. In a 1923 article in the Journal of Hygiene, he and his co-author G.S. Wilson described this phenomenon as herd immunity. Potter and Copley do seem to have been thinking along the lines of the modern concept, but many aspects of this early history remain unclear. We don't know what happened to herd immunity between 1893, Salmon's work on pigs, and 1916, Eichhorn and Potter's work on contagious abortion in cattle. Potter and Eichhorn worked for the USDA. Did they know salmon? Did they know Birch, who wrote about herd immunity in pigs? No one has figured this out yet. And it is also unclear how the phrase jumped the Atlantic. Major Greenwood was a prominent British epidemiologist who studied swine fever, may have played a role, but a direct link has not been found, and Greenwood himself doesn't use the phrase until much later. You could also ask, did similar ideas circulate in Germany or France or Netherlands or any place else? They may have, but that would require searches for different words in different languages. As more and more sources are digitized, future historians will likely find earlier occurrences of herd immunity, but really nailing down this full history will likely require the traditional tools of historical analysis, such as careful analysis of archives and personal papers, as well as detailed knowledge of individual and institutional biographies. Now, once herd immunity was established in Topley's thinking, the idea moved quickly from animals to humans. In 1922, Topley suggested a parallel between outbreaks in mice and outbreaks in human school children. He also wondered whether measures already in vogue in dealing with epidemics among livestock, where methods of segregation are so much more easily enforced than among human populations, might inform decisions about school closings and epidemics. Topley's musings soon found their test. In 1923, Sheldon Dudley, professor of pathology at the Royal Naval Medical School, became aware of epidemics of diphtheria at the Royal Hospital School in Greenwich, just outside of London. The school provided laboratory-like conditions, with a homogeneous group of male students in good physical condition who entered in batches to the school several times a year, where they slept in dormitories which had between 70 and 130 beds. Dudley studied these students and complemented his data with studies from the Grand Fleet during the war and from the training ship, the HMS Impregnable. Dudley published reports for the Medical Research Council on diphtheria and scarlet fever, on droplet infections, and on diphtheria immunization. He believed that Topley was right, that analysis of experimental epidemics among communities of mice provides at more than one point striking parallels to the observed phenomena among the boys at Greenwich. In a 1924 article in The Lancet, Dudley first applied herd immunity to humans. Now, at this point, the language becomes undeniably odd. Most of us don't talk about herds of humans. Dudley, however, did, and he did so often. In a 1929 article about human adaptation to the parasitic environment, he wrote, quote, "I will now consider the community or the herd. Nations may be divided into urban or rural herds, or we can contrast the shore-going herd with the sailor herd, or the herds dwelling in hospitals can be compared with those who live in mental hospitals." Dudley's glide from animal to human might have reflected established British traditions of animal symbolism. As historian Harriet Ritvo argues in The Animal Estate, the English had long used animals to represent various British national identities. Now, Dudley's language did give some readers pause. He prefaced his 1934 report, Active Immunization Against Diphtheria, with photographs of, quote, the human herd, the Greenwich boys at dinner in their cafeteria, and the bacterial herd, the colonies of diphtheria on culture media. As a commentator in Lancet noted, anyone with a modern sense of social progress might wonder whether the phrase, the human herd, is here used in a scientific or in an ironical sense, but perhaps in this case, the meanings are not too far apart. The idea also intersected with eugenic notions of racial difference at a time when eugenic racism was ascendant in the England and United States. An author of a 1931 Lancet piece wondered whether specific groups, the Maori, for instance, had racial herd immunity to different kinds of diseases. Regardless of these concerns, herd immunity became a fixture in epidemiology by the 1930s. You can find discussions of herd immunity for influenza, polio, smallpox, and typhoid in textbooks, journals, and public health reports in England, Australia, and the United States. So this is where George Davies Smith might enter this story. The American researchers had studied livestock herds, so their language of herd immunity made sense. The English, however, studied mice. Topley and Dudley did write about herds of mice, but as Smith explained in his talk last March, this is incorrect. The proper term for a group of mice isn't a herd of mice, but a mischief of mice. Smith joked that Topley should have written instead about mischief immunity. Had he done so, the concepts would have had a useful multiplicity of meanings, especially over the past year. I think we should join Smith in wondering whether debates would have played out differently with COVID had we all been discussing mischief immunity instead. Well, one form of mischief emerged right away. What did these authors mean by herd immunity? Dudley focused on what share of a herd had acquired resistance from natural exposure or immunization. That's a relatively narrow definition, one quite similar to our usage today. Topley elaborated a much more expansive concept. Immunity wasn't all or nothing. Individual immunity existed along a continuum. And herd immunity was more than just the sum of all individual immunities. As he explained in 1935, herd immunity encompassed not just the distribution of individual immunity, but also the social factors that determines the herd's exposure. He argued that the English herd, people living in England, had herd immunity to plague, to malaria, and to typhus because they no longer lived in close association with the requisite vectors and were therefore protected from this disease. They had herd immunity. And you can see how this distinction might be relevant with COVID today. Consider the case of New Zealand. Dudley would say that New Zealand is nowhere close to herd immunity because too few people there have been infected or vaccinated. Topley, in contrast, would say that New Zealand has had herd immunity for most of the pandemic. And most of that line, they were just having 1 or 2 cases a day because social arrangements there have prevented the virus from spreading widely, effectively protecting the population. So Topley would have said that these kinds of social arrangements themselves can confer herd immunity on a population that is behaving carefully. Now, different concepts of this concept between the extremes of Topley and Dudley circulated from the 1930s through the 1960s. Virologists and epidemiologists who tracked flu epidemics wondered if new epidemics of flu occurred either when herd immunity generated by a prior epidemic had waned, or, noting flu's ability to shift and drift, they suggested that epidemics happened whenever the virus had mutated enough to escape from the herd immunity that had been generated by the past epidemic of a different strain. With the development of new vaccines after World War II, herd immunity was increasingly used to describe the goal of mass vaccination campaigns. Robertson, the student from Princeton, describes how Jonas Salk wrote about the herd effect. He was quoted as talking about herd immunity, but his actual language was about the herd effect. And while his phrase was different, his meaning was similar. The penumbra of immunity that extended beyond those who had been vaccinated to protect those who had not been vaccinated. Attention gradually began to focus on a single number. What share of the population had to be vaccinated to prevent or contain an outbreak? In 1970, Charles Gordon Smith argued that the threshold needed for protection depended simply on the transmissibility of the pathogen. And you can see the echoes of this in the common mathematical expression that the threshold is 1 minus 1 over R naught. The mathematics of this was developed in much greater detail in the 1970s and 1980s by John Fox, Robert May, Roy Anderson, and many others. If you look at actual occurrences of the phrase became much more widespread in the 1990s, according to the Google book corpus. This history has not yet been studied in detail by historians or epidemiologists, but I assume it reflects how the idea in the 1990s moved out of academic epidemiology and into broader discussions of public health policy. It certainly came up repeatedly in discussions of vaccine hesitancy, especially with measles, a disease that requires extremely high rates of vaccine coverage to maintain herd immunity in a population, as we had seen with the various outbreaks of measles that occurred before COVID. Now, when COVID struck, herd immunity quickly jumped to prominence. In the absence of a vaccine, policy advisors wondered whether the best course was rapid and widespread exposure to the virus. A British pandemic advisor, Graham Medley, for instance, said that we are going to have to generate what we call herd immunity, which would require a nice big epidemic. Later regretted that language, but stands by the substance of what he said. Chief Scientific Advisor Sir Patrick Vallance believed it would be possible, to, quote, to build up some kind of herd immunity because most people suffered only a minor illness. When that idea received furious criticism, British officials denied that herd immunity had ever been part of their plan. That had been very well documented, so those denials were hard to take too seriously. Officials in Sweden also briefly endorsed a policy of widespread infection in hopes of quickly achieving herd immunity, explaining that a widespread epidemic was basically the same thing as a mass vaccination campaign. This prompted mathematician Marcus Carlsson to object. He called the Swedish policy Russian roulette. Now, the appeal of herd immunity is easy to understand. If it is reached, an epidemic ends. But there are several problems, especially with these British and Swedish proposals. One set of concerns was about morbidity and mortality. If people had simply let the virus run through the population until 70 or 80% had been infected, many people would have died and countless others would have gotten sick. If this had happened simultaneously enough, hospitals would have been overwhelmed, further exacerbating the mortality. And it was these kinds of concerns that fueled the very strong backlash against the let it rip approach to COVID. Others objected to the phrase itself. A herd usually describes domesticated animals, especially livestock. Herd animals like cows or goats or sheep are sacrificed for human consumption. Few humans wanted to be part of that kind of herd, and no one wanted to be sacrificed. As Marcus Carlsson had noted, we are being herded like a flock of sheep towards disaster. I'm talking about the Swedish policy. And the science itself soon came to be challenged. Studies in June and July of 2020 cast doubt on quick prospects for herd immunity. Antibody surveys in Spain and Switzerland that summer found that despite months of exposure, fewer than 10% of city dwellers in Spain or Switzerland had antibodies. Commentators in The Lancet concluded that in light of these findings, any proposed approach to herd immunity through natural infection is not only highly unethical, but also unachievable. World Health Organization's Michael Ryan told journalists in August 2020, quote, "We are nowhere close to the levels of immunity required to stop this disease transmitting. We need to focus on what we can actually do now to suppress transmission and not live in hope of herd immunity being our salvation." Now, Topley, of course, would have objected to this distinction. Topley would have said that suppressing transmission is a way of achieving herd immunity, but that distinction had long since been lost. With vaccines still a distant hope in summer 2020, many countries remained resigned to the need to suppress transmission and flatten the curve, knowing that this would create a prolonged pandemic and prolonged economic disruption that would linger for months, if not years. British public health expert Raj Bhopal likened the situation to being in a zugzwang, a position in chess where every move is disadvantageous, where we must examine every plan, however unpalatable. He sought to overcome the animal connotations of herd immunity by encouraging the use of the phrase population immunity instead. But as he knew, changing the label of herd immunity might have removed the herd connotations, but it would not have fixed the basic problem. Without a vaccine, many people would have to die from COVID-19 before population immunity could be achieved. But just as COVID has repeatedly faded only to surge once again, herd immunity has done exactly the same thing. Defenders of herd immunity have persisted. Some argue that in response to the low seroprevalence surveys of antibodies, the antibodies aren't essential because SARS-CoV-2 might induce durable T-cell immunity. Others speculate that if the most vulnerable members of a community are infected first, then herd immunity might actually be possible with just 20% of the population exposed. We now have good reason to believe that's not actually the case. Meanwhile, other seroprevalence surveys soon returned more optimistic results. 68% of people in Corona, New York, who attended a clinic had antibodies by July 2020. Prevalence was similarly high, 57% in Dharavi, one of Mumbai's large urban slums, and 76% in Manaus, Brazil, by October. Seeming to ride this new wave of findings, herd immunity returned to prominence in certain political circles. In late August 2020, sources revealed that the White House, following guidance from radiologist Scott Atlas, was pondering a policy of herd immunity. Officials issued a prompt denial. The idea received its most dramatic incarnation in the Great Barrington Declaration, issued on October 4th last fall. Several researchers, including one here at Harvard, proposed dividing each community into two groups, those who are vulnerable to serious effects from COVID and those who are not. They recommended allowing the people who were not vulnerable, especially people who are young and healthy, to go about business as usual. The idea was that the virus would then run through those populations and generate herd immunity, at which point the epidemic would dissipate. Meanwhile, those who are vulnerable, such as the elderly or those with pre-existing conditions, would be locked away in some safe mode of protective custody. 175,000 signatories lent their support to this declaration. The whole effort soon descended into a farce. Most people realized that the proposal was unworkable. First, no one is not vulnerable. Even though serious illness in young adults is rare, it does happen. An uncontrolled epidemic would take a serious toll. Second, there would be no practical way to protect the vulnerable while providing them with any kind of meaningful existence. Third, there were soon allegations that the enterprise had been supported by a libertarian think tank funded by oil companies, tobacco companies, and the Koch brothers. And fourth, some share of the signatories proved to be jokes, including Mr. Bananarama, Dr. Johnny Fartpants, Mr. Person Fake Name, Professor Nadaf Akinklu, and in honor of the early English advocates of herd immunity, Professor Kamenek Dumings. So since that time, we have seen the best of times and the worst of times for COVID. Fall 2020 witnessed the largest US wave. Vaccines were approved in the midst of that, with Pfizer getting the emergency authorization December 11th, and then Moderna and Johnson & Johnson following. These gave new relevance to the concept of herd immunity. Communities could set out to achieve that magic threshold, not through mass exposure, but through mass vaccination with far fewer illnesses and deaths. Biden set his goalpost at 70% vaccine coverage, which had been the initial estimate of the threshold needed for herd immunity for SARS-CoV-2. The epidemic indeed receded dramatically in the US by February and bottomed out in July, giving hope to many people that we would have a normal fall. But there were bad omens. In March, the Delta variant emerged in India and created a catastrophic epidemic there, one that produced one of the most apocalyptic images of COVID, the huge collections of mass funeral pyres. When George Davies Smith spoke here in March, he made a cryptic comment. At that time, the Alpha variant, B.1.1.7, had largely saturated England, driving out the original strain of SARS-CoV-2. But when he showed his graph of strain frequencies, someone in the audience noticed that Alpha wasn't at 100%. Smith said that yes, there was another strain out there that was proving to be robust. He didn't specify, and I wonder in retrospect whether that was the early arrival of Delta in England. I'd be curious if anyone knows. I asked Mark, and he didn't know whether Smith's March data was reflecting the Delta variant. But in any case, Delta soon was everywhere, triggering an outbreak in England in June and the United States by August. Delta is more transmissible than previous strains, and as any good epidemiologist would know, its threshold for herd immunity must be higher. Researchers now estimate 80%. One commentator in England said that this threshold was unachievable, even mythical, given high rates of vaccine refusal and the continuing inability to vaccinate children. However, it is conceivable that this level, 80%, could be reached in the US by a mix of vaccination and widespread infection. Last week, an analysis of donated blood samples found antibodies in 80%, and that was just through July. It's presumably higher now in September. But that finding itself was confounded by a number of different ways, so you can't really conclude that 80% of the whole population has antibodies. And so the question is, so where do things stand now in September of 2021? What have we learned? The past years has been the best of times and the worst of times for herd immunity, not just for COVID. The new relevance of the concept has motivated substantial research that should improve our understanding of the dynamics of epidemics and our ability to model future outbreaks. And with Mark Lipsitch, soon to become the head of modeling at the CDC, we look forward to seeing what great results they have there. But the concept has also wreaked havoc on the global stage. The countries that discussed herd immunity most enthusiastically, England, Sweden, Brazil, and the United States, are all overrepresented on COVID's bill of mortality. And so by way of conclusion, let me highlight a few points, and I'm sure there's much more that could be said, and I look forward to hearing the thoughts of those of you in the audience. We should have plenty of time for discussion. First, why is the concept so appealing? Now, the enduring popularity of herd immunity isn't that surprising. Everyone loves the idea of immunity. It sounds like a superpower, a state of privilege. I was trading emails with Emily Harrison last week, and she had observed that the media discuss herd immunity as the point in which we will regain control over the pandemic and our lives, and that this fantasy of control has become a public obsession. Other people in the media and the consumers of media like herd immunity because it's a technical term that almost anyone can grasp. Emily said that she has many analytically oriented friends who have spilled a lot of ink on Facebook, offering their own calculations and projections of when herd immunity will be achieved. But there's also clearly a political agenda beneath this. From Boris Johnson's advisors to Scott Atlas and the Great Barrington Declaration, libertarians have actively pushed herd immunity as part of an effort to liberate economic interests from what they see as the nuisance of public health. Second issue is, why has this concept been so confusing? And if anyone has time to look at this, you know, the AMA just last week released this press release about what doctors wish patients knew about COVID-19 herd immunity, examining specifically why they think it's so confusing. And if you look at this statement, the doctors they interview get many things about herd immunity wrong. So this effort to alleviate confusion about herd immunity, I think, actually sows as much confusion as it alleviates. So why is this? I think the confusion is inevitable because the concept has always been unstable. Over the past 130 years, theorists have articulated different concepts and always called it herd immunity. The percent who must be exposed and recovered to protect a herd, the kinds of social structures that can be imposed to prevent epidemics, the extent of vaccine coverage required to squelch transmission, These are all distinct things, but all of these have been termed herd immunity. As happened in the winter of 2020 with discussions of R naught, people fixate on a single number, in this case, the single number at which herd immunity might manifest. But as both Salmon and Topley wrote early on in this history, immunity is complex and multifactorial and cannot be reduced to a single number. Now, as we learned in the first months of COVID, many things can affect R naught: mask wearing, variant strains, school closures, and much, much more. And all of these will also affect the herd immunity threshold. Now, if we were fastidious and reduced R naught, herd immunity would be easier to achieve. When we are not fastidious and the total viral burden increases, either in the US or on a global scale, then we increase the risk of new, more transmissible variants. And so now there's this looming concern about the Mu variant, or the Mu variant. In many respects, we ourselves determine what herd immunity will require based on the decisions we make about how to live our lives and the social structures in which we live. And we determine whether or not we will achieve herd immunity. Even if we only get close to the threshold, that might be progress enough, as Mark and colleagues described in their recent editorial last spring in the New York Times. But all of this is at risk of becoming a self-fulfilling prophecy one way or the other. Now, Tony Fauci, who'll be speaking later this fall, has last spring famously increased his estimate for the herd immunity threshold from 70% to something over 80%. Now, when he did so, he was likely being a good empiricist, reflecting new knowledge, especially new knowledge of the shifting variants. As I'd said, Delta is more transmissible, so the herd immunity threshold for Delta will be higher. But unfortunately, Fauci came across, at least according to Fox News, as either someone who is unsure of his science or, worse, a political manipulator who is moving the goalposts for some nefarious purposes. This then fuels resistance to public health measures, which further increases the threshold required for herd immunity to be achieved. Herd immunity is both the sum of individual immunities and an emergent property of a population, one that is shaped by both individual and collective action. It has been vexingly difficult to communicate this in a way that motivates optimal behaviors, especially within the United States. So what should we do about this? I think the media needs to stop debating whether or not herd immunity can be achieved. It clearly can be achieved. We just need to figure out how to inspire the choices needed to achieve it. Some of this might involve a greater willingness to take risks. For instance, this month, the United States has embarked on a grand experiment that Sheldon Dudley would have recognized in the 1920s. Millions of unvaccinated children are being returned to classrooms in public schools, many of which don't have mask mandates. This will certainly accelerate the epidemic, contributing to herd immunity, but at the risk of increased mortality and morbidity. There could have been another option. The Food and Drug Administration could have approved these vaccines for school-age children in July. And then all these children would be returning to school fully vaccinated. Now, I understand at some level why the FDA did not. The FDA hopes that fastidious adherence to the highest standards of vaccine testing will minimize the risk of a problem or a backlash that would threaten not just COVID vaccination, but the entire enterprise of childhood vaccination for all vaccine preventable illnesses. And so I get that, but at the same time, because of this reluctance to move more aggressively to authorize the vaccine for children, many children and many unvaccinated adults will get sick and die because of this decision. And moreover, there's always the risk that the large pool of virus now circulating in this country and globally will generate a new variant that is actually worse than Delta. And this raises one last way in which herd immunity has been mischievous. Most of the discussions in the United States focus on what we need to do here to achieve herd immunity here. But that's the wrong question. As most people here know, we are not in this alone. It might be possible for the United States to achieve herd immunity against the current strain, but as long as most of the world remains unvaccinated, new strains will continue to emerge. the US needs to focus less on optimizing our own immunity, for instance, through booster shots, and more on raising levels of global immunity such that global transmission is reduced. Only then will decisive and enduring control be possible, and will COVID itself become less mischievous. Thank you. And as I said, I look forward to hearing questions and comments from all of you who know much more about aspects of this than I do.